Well, it's hello again. I hope you're still with us and haven't signed off quite yet. You know, you can't go and get your breakfast, lunch, supper, bed, whatever point in the whatever spectrum of the time frame you're on, because we just wanted to do a little bit of a reflection here on what you've heard this afternoon. Just a couple of points from me. I do take David Swenner's point and Jonathan Fell's point about the information that is actually out there. And I've got a fly buzzing across my face, so there you go. It's probably someone from the anti-tobacco harm reduction lobby sent in a little fly drone to find out what's going on. Anyway, that information is out there to the Securities Commission and to all sorts of different organisations, but it needs interpretation. I mean, people like Jonathan and David are very good at looking at these graphs and finding all the interesting stuff that's in there. Many of us are not blessed in that way. So we do need a way of extracting a lot of this topical, well-judged information, which, as David said, you really don't get away with trying to fool you know, Federal Security Commission agencies and all the rest of it. So it'd be really good to find a way to extract a lot of that information to make it usable for consumers and advocates, and to be able to present it to politicians, because I'm sure most of those wouldn't understand it either. So that's the first point I wanted to make. Second point I wanted to make is this business of innovation. Now, I was very taken by Charles Gardner's comment about the fact that, if you like, the edges of opposition to marijuana, to cannabis, the edges have been blurred by, in a sense, bringing it in from the cold in terms of medicinal use. Now, some people have got a problem with that, they want it medicalised and all the rest of it, but it certainly, in my opinion anyway, helps to soften attitudes, and I think that certainly happened in the USA. And in another way, in this country and in America, there are clinical trials going on about psychedelics, about ketamine, ecstasy, psilocybin for possible use in anxiety, depression, post-traumatic stress disorder. Now, that doesn't necessarily lead to legalization for recreational use, but it begins to soften the edges of a kind of sort of them and us across the Great Divide approach. And the same kind of thing is has got the potential there for nicotine, not just as a medicalisation of nicotine just to help people cut down or stop smoking, but in other sorts of innovative ways. Jonathan touched upon it there in terms of vaccine, and I'd just like to bring in Sarah here because she's very knowledgeable about what's been going on within BAT subsidiaries on this very subject.
Thanks, Harry. Yeah. It's true. So we have a subsidiary in America called Kentucky Bioprocessing, and they have been working on a novel platform to develop and manufacture vaccines. And the two really exciting things about it is the speed from which you can go from deciding you want to have a pharmaceutical, a vaccine, to when you have it in your hand. It's just 6 weeks. And the second very exciting thing is that the vaccine products are stable at room temperature for considerable lengths of time. So if you think about that could just totally change vaccines for the developing world and creating sort of equality for vaccines. And it's because the tobacco plant is a really, really exciting factory. You can get it to do really amazing things.
Right. I remember a few years ago at the Isentech session at GFN. This is where I first heard about this, because somebody from that company was talking about Ebola vaccine, and I kind of sort of sat up in my chair at that point and thought, what? How the hell do you get the Ebola vaccine out of a tobacco plant? So where did that go, or how was it? What kind of happened with that?
So what happened with that is it was a collaboration with a pharmaceutical company, and KBP manufactured the treatment that had been developed by this other company. And it was used successfully in the field to treat several American aid workers.
Right.
It didn't become the dominant treatment for Ebola, but it sort of showed the power of plant-made pharmaceuticals. And the focus for KBP today is much more on vaccines rather than, well, actually there's lots of different things that's focusing on, but at the moment we're working on a COVID vaccine and a vaccine for flu.
Right, okay. And I think you mentioned earlier to me that PMI were kind of doing a similar kind of exercise.
There's a company in Canada, in Quebec, called Medicago, and I believe Philip Morris have a stake in it. And they're also using, it's a different sort of technology, but they're also taking advantage of the quite amazing nature of tobacco to make plant-made pharmaceuticals. And they're also working on a COVID vaccine.
Right.
And both are in human, both the KBP and the Medicago vaccine are in human clinical trials at the moment.
Okay, so fingers crossed that they get through their, what would it be, stage 3 clinical trials, and then we see what happens after that.
Yes.
Right. Okay, so turning to Martin, again, this product, this idea of nicotine innovation, I mean, there's a few issues around that. One is about the products themselves. I mean, where do you think we are in we've come an awful long way, I think we mentioned this before, in terms of, the different sorts of products that are available for people who you want to switch away from cigarettes. But what's, apart from getting rid of all the regulations, I know you would say that. But that aside, just in terms, because we'll come on to that one tomorrow, that'll be a subject for tomorrow's conversation. But just in terms of the actual product development, in your personal taste, where are we at with all of that? What do you think is coming around the corner? What would you like to see? What have you heard about? What's in the pipeline?
I'm not sure what's in the pipeline. I mean, it was interesting hearing Bengt talking about his sting-free snus, because, and he gave some figures, because I'm firmly in the 17% who likes the sting, so I probably wouldn't be buying his product. But obviously, that's an example of how innovation can go, just to sort of hone in on what particular consumers like or need, because we're always making the point that there is no archetypal consumer. All the consumers who used to smoke are different. Some get on with vaping, some get on with heated tobacco, some get on with snus and pouches and stuff like that. So the innovation is going to come as a reaction to how the market works, the consumer market and what they're buying. I mean, we've seen a lot of consumer-led innovation already. The way battery strength has driven better e-cigarettes, for example, and even the shape and the size of these cigarettes. I'd say also that regulation affects innovation in all sorts of ways. So when regulations started coming along, which would ban vaping in places, vaping devices tended to get smaller and more hideable. And that's probably a reaction to how the regulations were affecting innovation. I don't know how far you can go with battery strength. I mean, maybe the batteries will get more and more effective, and you can have maybe the limits of nicotine can be lower. We see with Juul in America, you've got the high strength, which works very well over there, which you can't get over here. And the ones over here, just in my opinion, tend to be rather weak. I couldn't have used a Juul under a TPD compliant Juul to switch from smoking. I would have needed a higher limit. But maybe in the future you might get ways of innovating in those products so that they can be more effective at lower strength.
Is there a kind of dialogue between consumers and manufacturers and product developers, or do they themselves tend to be the users, and so you get the product development kind of in-house? I mean, does ETHRA and other bodies actually get to talk to the people who make these products, or do you just wait for something to come on the market?
I don't think consumers need to. I think consumers really in any market would just vote with their wallets, wouldn't they? So I presume a lot of companies, especially large ones, they watch the market intensely. I mean, John would probably say the same thing. They're watching the markets all the time to see where the market is going and where their customers are going, and where the customers go, they have to go too. So I'm not sure you really. I mean, I don't think ETHRA speaks to industry. I don't think we really do. And even if ETHRA did, industry would probably say, "Oh, thanks very much, but we've looked at this and we kind of know what we're doing."
That's fair enough. That's fair. So, which leads me to my kind of sort of final question, really, because I'm sure people want to get away and do their thing, because it has been a long day. But Jonathan was talking about the whole business of the ethics of where you get your products from, and some people care and some people don't. I mean, is that much of an issue? I mean, is there sort of heated debate amongst the consumer groups about the ethics of the end where these products are coming from? Or it's like they produce what I want, so who cares?
Yeah. I wouldn't say it's heated debate, but there isn't. It's not exactly a debate, really. It's just different preferences, I suppose you'd say. Right. I mean, I'm kind of vapor. If there's something I like, I don't really care who makes it. Right. But there are some people who now they're vapors. They've kind of resented the tobacco industry for getting them into that position in the first place, and so they just don't want to buy a tobacco product. You know, and so you do see some vapors who just say, I would not buy anything if it was made by a tobacco company, and sometimes with some animosity. Especially, I seem to remember years ago on YouTube reviewers, but they seem to have gone the other way. When the threats came in, they kind of thought, well, maybe we shouldn't sort of push these people away because they're making products that can create other vapors who can be on our side, you know.
And given the fact that the large companies will take over smaller companies who might then take over. I mean, is it? And this is as a non-vapor and is it easy to trace the provenance of what you're buying?
Well, I mean, for someone like me who's a bit of a geek, I suppose I know who makes them. But yeah, I suppose if you look in the supermarkets, they tend to sell the pod mods and the simple devices, which is. Like staff who work for me tend to use those rather than tank devices because they're just easy to get from the supermarket when they go shop.
And those are the ones that are going to be coming from the major companies?
Most of them, but I've noticed there are some, when I have noticed in the shops, that are made by independents, and they're in there as well. But how much independents want to go for pod mods or whether they want to stick to the devices they've got, I don't know. And whether they would want to get them into a supermarket rather than a bricks and mortar vape shop. Yeah. It's that kind of thing.
Okay. So we are going to wrap this up now. Anything that particular, and the answer can be no, so don't worry about it. I'm not putting you on the spot. Yes, I am putting you on the spot. Is there anything that's kind of cropped up today that you thought, I would rather, he didn't ask me about, I would quite like to have mentioned this, or this kind of, caught my attention? Or do you think we kind of nailed most of the interesting stuff, because it's all been really interesting. But anything that caught your attention that you'd just like to chuck in there at the end of the day?
There was one thing, actually. I'm trying to think what it was now. It might come to me. Is there anything you...
Well, I was thinking back about funding. And the industry is able to invest a lot of money in improving innovations in vapor products and heated tobacco products. And also funding to test them and to generate the results. And I think that it's really important that that the science is sort of judged on its merits. It's kind of going back to what was talked about this morning. It's judged on its merits.
Important point.
And I think that a lot of the innovation is going to come from inside the industry for those reasons. And we do understand the sorts of things that consumers would want to see in terms of innovation, I think.
Okay. Did you?
It's come to me. It's come to me. It was to do with when Roberto and Brad were talking about, especially Roberto was talking about how physics, science was in lockstep with, and we discussed that, and you mentioned Galileo. Well, even Roberto said himself that if you do come up with something that's a bit disruptive, it could be something that you might get marked down for. Yeah, sure. So I think there's always that. But what I would have thought in physics that if you're going to put something in a scientific paper, you'd have to have solid grounds for doing it as a physicist. Whereas I'm often surprised at how poor and lax some of the stuff that goes into tobacco control research can actually be. So if I've just got time to give a quick example of where it affected us as the NNA, a study came out, a very good study, in addiction, but somehow someone had put in there that we had funding from industry, which was completely untrue. Now, we wrote to addiction. Unfortunately, the editor-in-chief, John Marsden, was very good about it, and he said, yeah, that should be in there, we'll take it out. But how did it get in there in the first place? You know, well, how does something completely false get in there? As Konstantinos was saying, you'd think there'd be more rigor, and I would have thought that would be the difference between physics science and tobacco control science, that I would have thought physics would be far more rigorous what actually gets in.
And I think probably, I think somebody made the point about that there really isn't that. Yes, I'm sure there's controversy in physics. You know, people think there is string theory, and other people think string theory is nonsense. But they're not going to necessarily start trying to smear you and ruin your career by you know, going public in journals and getting the stuff accepted. So there is a much more, you know, egregious kind of nonsense going on with some of the journals that, for whatever reason, morally driven, Puritan, anti-tobacco, all of the stuff that we've heard today, that means, I think, and this is a personal view, because of this link with big tobacco and the evil empire and all of that, it's almost like you can get away with anything. It's like it doesn't matter if your methodology is complete crap, the chances are it will get in there because you're sticking it to the man. And unfortunately, you would think that editors and peer reviewers and stuff would be a little bit more kind of honest and balanced and stuff, but there are too many examples, and they're growing all the time. And I know that Professor Jerry Stimson from KAC has been getting quite good at lodging complaints and not letting these journals get away with this kind of thing. And I think that's an important point to finish on. I mean, we've been talking about, you know, lobbying MPs and lobbying here and making the case there and consumer voice and all of that. But I think also, and it is happening, and I think it needs to happen more, the journals who are prepared to go down that road do need to be called to account. And whether they publish responses or not, what the important message is there is you are being watched. We're not going to let you get away with this stuff anymore. And I think I'm going to close that, and thank you very much for your efforts today. And I'll see you back in those seats at 11:45 tomorrow morning. Thank you very much.
Thank you.